Donc, bienvenue encore.
So welcome back to this conference
Santé.
with Santé Publique France and the French presidency of the European Union. Up to now, we were able to link health to
Maintenant,
the fight against climate change. And now we want to talk about how to improve integration of climate, biodiversity, and public health in public policies. It is a real challenge, and I've been living in Brussels for more than 10 years, and I can see that how within Parliament, within the European Commission, this is a very topical issue. Opinions vary about this topic, and we'll be able to talk about it during our panel. You can ask your questions on our platform. I think now our technical issues have been solved despite the heavy rains outside. And there's also a microphone that we can pass around if you're here in the room. Think about the hashtag SPFrance, INF, and For Climate. Do send messages, tweets about what you can hear during this panel. It would be very beneficial if the rest of the world could hear about what we're talking about here today. Let's start with Magali Regueza. Magali Regueza is a senior lecturer in geography at the École Normale Supérieure, ULM School of Higher Studies of the French High Council for Climate, and Geneviève Chen, Executive Director of Santé Publique France, John N. Newton, qui vient de l'Université d'Exeter,
Manager for Sustainable Development, Pilot Hame Region.
Rita Maija Hamelian, who is Manager for Sustainable Development, Päijät-Häme Region, a joint authority for health and social welfare in Lahti, Finland. So Magali, why is health not very present in public health policies? Thank you for your invite, first of all. And I'd like to comment on what our young colleague said this morning. Since this morning, we've been wondering how we can switch from an observation and the will to act and what we can do at the operational level. So why would we have more reasons to act now compared to when the first IPCC report was published more than 32 years ago? I think we were all very young then. And you can remove your mask, yes. So some issues about health as well. Health policies, public health policies have been integrating these injunctions within the main large health pillars. So we want to switch from curative to something that is more preventive, looking for co-benefits. That's been done in many public health policies. For instance, when you're being told stop smoking, here you can see the co-benefits of stopping cigarettes, the use of cigarettes. Regarding climate, continuous policies in time, despite instability and political instability, we can see how we've been changing political parties and how this can be an obstacle for these policies. That's the case in France and other European countries. We're going to ask ourselves these questions at each decisional stage level. Within states, we're talking about the executive power, but also the legislative power. What is happening within parliaments? What is happening within central administrations? It's the same as well for the territorial level, the regional level, and they rely on coalitions of regional public stakeholders with governances that are very different from one another. So the issue of public policies is fundamental because whether we're talking about health, climate, biodiversity, even if private stakeholders must play a role, our democracies do have a leading role to play and must lead by example. They are accountable. So first question, to take into account these three areas, and we know that within the IPCC reports, it's been long. We have taken a long time to integrate those three issues. And when we look at how public policies are made in most democracies, nation states, we see that each sector, health, biodiversity, climate, will require specific skills, specific know-hows. So yes, we can say we need to be cross-cutting, we need to be systemic, but in practice, it requires a certain level of expertise and breaking down silos. So yes, think about global level, but structurally speaking, making public policies is following this method. So yes, we can reverse the issue. So why wouldn't be a better option to make the frameworks more relevant, the already existing frameworks more relevant, rather than reinventing the wheels? In France, we create more organizations, and in the end, we can't progress. So first requirement, which is a prerequisite for each public policy, is to better understand the relationship between climate, biodiversity, and science. So it could be obvious for people who are constantly working on this topic, but it's not the case for everyone. So in the IPCC, even within the scientific community, there have been breakthroughs, and they're the result of public policies that have invested in science. And if you've been working on this, you probably know the What Else concept, One Health, One Planet, and we see that certain countries, such as France, in its recovery plans, in the investment in future, have invested credits, funds to allow fundamental research to progress on this. In this research, we forget to put forward social science, the social science, social and human science dimension, or they're reduced to the economical impacts and the behavioral issue. But in the IPCC report, it's been said that we must work on society, on social levers, so that we avoid reaching tipping points. And once we've identified these issues, these evidence-based issues, we need to better understand, to measure the impact on individuals, collectivities, communities, and we're far from having these assessments. Valérie this morning talked about the ripple effect. So we need to think about this to link it with public policies. For instance, earlier you talked about mental health, something that had been a blind spot for years, and the link between biodiversity and mental health must be established. Studies today show that there is a correlation between an access to an environment with healthy biodiversity and people's health. We don't know why yet, but we know that there is a connection. Many fields are not taken into account. For instance, prevention of health risk, the issue of aging, bee protection, and aging. We don't see the link for now, but the issue of disability care. And what is within public policies is compensation systems. In France, public stakeholders, parliaments are considering social security, funding, in insurance, many economic fields. We talked about malnutrition this morning. We talked about the health-related challenges, health crisis. This is a first very relevant mechanism, the SDGs, the fact that in these diagnoses we can integrate SDGs. And the fact that we must systematically integrate vulnerability diagnosis. So what is the impact on people's health because of extreme events and the recurrency of these events, chronicle aspect? And what is the impact on a certain number of pathogens? So how will we survive tomorrow if our hospitals are not able to survive heat waves because our buildings are not well insulated, because we can have to face water scarcity. And in developed countries, we have for too long considered that these issues were experienced by developing countries, but actually everything is connected: biodiversity, public health. And today we see the impact on health professionals, because tomorrow, with extreme events, if health professionals are affected, then we won't be able to cure people. So how do you observe this? How do you link it to raising awareness with decision makers? The High Council for Climate I belong to, and Valerie as well, have been putting forward tools for public policies. First of all, we need to think about the right deadlines. We're not talking about 2050. We have insisted on carbon neutrality for 2050 and the boomerang effect, that is, within 3 years we must act. No, we need to have a timeline by 2025, 2030, with a regular assessment for our public policies. Right now, it hasn't been done yet, and we haven't directed the right means for this. We need to understand what is the steering level, the subsidiarity level, the role of states, the fact that each state has each history. For instance, the political history of Finland, Sweden, the US, Canada are not the same, and all solutions can't be a substitute for the other. And there is no regional optimal level. We keep looking for the best action level. Sometimes it might be at the city level, at the region level, at the municipality level, at the state level. It doesn't matter. And there is an action lever, and I will conclude on this, that is overlooked: territorial land use policies. And it is important because it affects material infrastructures, functions, the way we move around, and it does have negative impacts. We must understand that public policies that will integrate health, climate, biodiversity might have regressive impacts. Access to health for the poorest population, to health professionals. So we need to find compensation mechanisms to anticipate, and we need to mobilize funds to train people. And this goes beyond a state of emergency to allow progress in existing frameworks without necessarily looking for a modification, because we don't have time. All right, so we heard the academic side of this topic. Let's look at what Santé Publique France does. How can we implement this at the national level? These are health issues, but also we're talking about land use, right? Geneviève Chen, Executive Director of Santé Publique France. Thank you very much indeed. I'd like to welcome all of you who are online today for this major day. And as a General Director of Santé Publique France, I am proud to to be part of this day on climate change, climate emergency, and public health, so that we can make these links more visible between climate change and health. This is a priority in our work, and we all share the same opinion on how important public policies are to act on climate and to improve health. So how can we do more? That's the question today. And I'd like to talk about this interconnection. So one of the main missions of Santé Publique is to monitor health. And for this health surveillance monitoring, we need measures. We need to make these measures more visible. For instance, health impacts, whether the direct or indirect, for instance, damages related to air pollution and social impact as well due to populations, displacements, and the result of some public policies. So the idea is that we need to create indicators in all these areas. And today, these indicators are not used enough in the public policies making process. So we need these indicators and these measures so that we can establish priorities. And depending on the needs, we can then assess which kind of public policies are needed. It's important that we do this to assess the impact as well. In France, a report was written by Santé Publique France in 2021 on these indicators, and it would be better integrated in adaptation policies, adaptation to climate change. And 4 indicators are grouped together in the health and society article of the observatory, the NERC, and we need to keep building, developing these indicators in a certain number of areas and make them public. So let's have a look at the international survey. We see that there's a large diversity of indicators, and this is what the joint roadmap is about with the international network of national public institutes, the ANFI, so that we can group these indicators together and they become part of a framework. So what is a framework? We need to define challenges. So one challenge being a heat wave, for instance. What are the indicators in different areas, the dangers, exposures, vulnerability, impact, intervention? So the danger, for instance, here is the frequency, the intensity, the geographical area of a heat wave. These are concrete indicators. How do they evolve in time? Does it evolve? Does it increase? Does it decrease? And once public policies have been created. So yes, you are implemented actions via Santé Publique France, and you're working with stakeholders that are external to the health sector, for instance, the Meteorological Institute in France. Yes, indeed, we need to be involved with these kind of partners, stakeholders. The Meteorological Institute in France is measuring temperatures, and it can give us information, alert us when there is a change, and we will measure the impact on health. So, for instance, who is going to A&E at the time, who needs to see a doctor when there are symptoms, to send a doctor at home. When do we need to trigger an alert? So, yes, we're working with other actors, such as Météo France. We're working with the Agency for the Environmental Transition, and we create measures on air pollution, the impact of air pollution, work with cities. And I'd like to get back to the different categories of indicators: vulnerability, social and economic precariousness, impact on housing, impact on access to care. We talked about monitoring systems. So there is a link between the health sector and other sectors, and this is what must be the result of indicators that are published together. And I'll conclude on this, but this is what the pandemic has taught us. We need to make these indicators public. They are, of course, useful for the decision makers to create public policies, then they must be made public for citizens as well, so they are better informed. And it becomes a lever as well. It strengthens the trust in public stakeholders. You are not representing the Ministry of Health. You are not the ones making public policies. But with Santé Publique France, you are an information center for politicians, for the public sector. Yes, a public health agency is using science-based data to then provide solutions, to be operational, to translate public policies, to be a support to make them, but also to be able to translate them for stakeholders who are implementing them. I'd like to give the floor to John Newton, who's the professor of Public Health and Epidemiology at the European Centre for Environment and Human Health.
By Magali and Geneviève. All this information we agree with. We know this is important, right? Yes. But from an informational standpoint, your hands are tied. You can only say so much. It's up to the politicians and the public to respond. Can I ask you that? How do you, from a European level, how do we make that happen from a European level and a national level? And we'll talk about Finland after that. John.
Yes, Chris, thank you very much. I think you've gone to the heart of the problem there with that question.
Yeah.
The first thing to say, actually, is just to thank all the previous speakers for making the case so fluently on the fact that we are at a critical point. I think Dermot referred to a closing window.
Right. Tick, tick, tick.
Tick, tick, tick. And Adelaide also, from the youth point of view, made the point that we need to think radically. We need to think differently.
Yeah.
So we have a closing window for 3 reasons, because we now know that the science is very strong, both on the effects and on the actions that are required.
Yeah.
We have a very high level of awareness, both amongst the public and amongst policymakers, and we have, to some extent, a willingness to act amongst policymakers. And I think that is perceptible at COP26 as well. In the way.
You don't think it was just a lot of lip service, COP26?
I think there was a lot of lip service,
okay.
But I think there was also some sign that there is a willingness to act from policymakers, which hasn't been there before. And from the UK context, we have our own Prime Minister, who is somebody who now does seem to understand the need to act. So little Good. Case of one there. So then the question is, it does become an implementation problem.
Yeah.
Now, I think the thing, and it's very important, first thing, it's very important that public health agencies, that Santé Publique France and the International Association of National Public Health Agencies, are taking a leadership position on climate change. That is a very important thing, and as a public health professional, I think that is very much to be welcomed. But that alone is not enough. I think the danger, if we look at the track record of how public health, but also governments have responded to previous threats, whether it's tobacco, whether it's air pollution, whether it's obesity. The track record is not good. We knew 60 years ago that smoking caused lung cancer and was killing people, and still we have tens of thousands of people every year dying from the effect of tobacco. So I think my argument, my response to your question would be that we cannot expect to use the same tools and approaches that we have used for these previous public health problems for climate change, because A, it may not work, and secondly, if it does work, it'll be far too slow.
Yeah.
So we have to be more disruptive. We have to move out of our comfort area. I think 3 specific things I'll mention, and then perhaps hand back to you. First thing is we need to recognize that from the scientific point of view, we need to assess the positive effects of environment and climate and biodiversity, as well as the harms. Traditionally, we've always thought about the harms, and we haven't properly measured the benefits. And that's, in fact, the purpose of our institute in Exeter was set up 10 years ago with that in mind.
What's the payoff here, right?
Yeah, exactly. So the nature-based solutions, the fact that, if we're going to approach antimicrobial resistance, air pollution, land use, food security, these are all the positive effects, mental health. There's very good evidence now of the positive effects of protecting the environment on health, but also more generally, of course, the co-benefits. So the first thing is positive as well as negative.
Yeah.
The second is different sort of networks. So it's no good the health sector talking to the health sector, working with hospitals. We have to go out, we have to work with the civil engineers. This is back to the 19th century when public health worked with civil engineers. We built, the people who built our world. They need to be our partners, and that's not going to be comfortable. It's not easy for us. And the third thing is the money, is the finance. There are many things where we know there is a positive health economic benefit, but that's not good enough. You have to have the money in the right place. You have to internalize the external cost. There are all kinds of things that have to be done before the money will move. So everyone will say, yes, of course we understand that this is cost effective, but we don't have the power to invest that money in that solution. I'm sorry, there's nothing we can do.
Especially since we've been spending so much on the COVID crisis and now in the Ukraine crisis.
Yeah.
I mean, how do we find the money for the environment?
Exactly. So the finances are critical to this.
Yep.
And then the final thing, as you mentioned, COVID, we have to learn the lesson from COVID. As Madame Chen said, surveillance is absolutely critical. Putting data out transparently, putting the data in the hands of the people who can use it to make a difference, whether that's the public, whether it's policymakers, the same data, all at the same time. Everybody has the information, and then we can move on. So, and then the fact that for COVID, the whole world got together to some extent, not perfect, but there was a level of international cooperation we've never seen before.
It's an example that we can mobilize if something mobilizes us, if we're moved to do it, right? We have to establish that common threat, which we've done time and again.
Indeed.
Let's see how, on a national level, this is working. And I would also like to once again ask those of you watching in here, in the room and beyond, please send in your questions, because I'd like to get to a few of them before we take our lunch break. You can put them in on the platform, and please, of course, hashtag SPFrance ENFI for climate. All three of those are great. Let's move to Rita. And Rita, you know what? I want to show your video first. It's a great video talking about how Lahti, Finland, is taking action. It's paying attention to all these things that we just talked about. Let's see that video first.
Että tähän laskettiin vuosikymmeniä kaikki Lahden jätevedet ja myös teollisuuden litkut. 60-luvulla järvi oli niin huonossa kunnossa, että koko Enonselkä muuttui vihreäksi. Sinilevää oli talvellakin ja vesi haisi
Awesome, Rita. And as John mentioned, how we have to work with civil engineers. We saw the stormwater guy talking about that and how important that is to work with everybody and make it happen. Tell us a little more about how it's going in Lahti.
Thank you very much for the.
We have your mic. Is it on? Try it.
Thank you for the invitation for the.
Is it working?
Is it working now?
Don't know. Hey, try this one. Yeah, it's working. It's working.
It's working. Okay. Thank you very much for the invitation for this very interesting panel discussion and the whole conference. I must say that I have two hats in the regional health authority, and I'm playing the sustainable development manager role, and then I'm also heading the Nature Step to Health program that is more focused on people. So if we think about in the city of Lahti and the Päijät-Häme region, health services are producing about 4% of the green gas emissions in general and worldwide. So we are trying to decarbonize our healthcare services. And how is that happening? We have plans to transfer the energy sources to renewable energy sources. Of course, we need a lot of heating in Finland, whereas in other countries it's air conditioning. But because of the climate change, it might be so that we need also build up our air conditioning systems in hospitals and care homes. So that is another area of increasing the green gas emissions, but we need to find the solutions. It's also that our transport fleet will be electrified soon. Another thing is that we need to also accelerate the digital services for patients and customers. As you understand, we have social and health services together. They are integrated services, and that way we are also decreasing the handprint of environmental handprint of the patients. Mm-hmm. But on the other hand, in the service level, we need to take consideration also the reducing the all appliances and products and so on, which produce also the green gas emissions. So we are building up the environmental criteria for procurement of that products and equipments.
I think an interesting angle is because there are disadvantaged in your territory, in your region, and how you're working with different actors to address their problems and connecting that with the environment.
Yes, I'm coming to that one.
You're coming to that.
Yes, because we have this Nature Step to Health program, that is 10-year program for the Lahti region. Then we are trying to improve the nutrition level. That means that healthy nutrition, but a lot of more plant-based meals.
Yes.
And that we are starting in the schools and daycare centers and also workplaces, so that the meal planning and so on is more plant-based products. Another thing is about mobility and mobility by bikes, walking, with public transport. We know by research that when you use public transport, you walk more. Another area is the living environment, where we can develop more connections to nature, and also the heating systems and other things that bring the decarbonization of the heating system. Also, we are building connections to nature, different trails. We have a geopark at the moment that is a really new area for inhabitants to visit and try to get the more people connected to nature. There are also many benefits of nature for those people who are suffering from mental health. And we are living in Finland with a lot of forests and lakes. We think that many people are disconnected to nature, and we try to bring that back to their life, and also for the disadvantaged people, as you mentioned.
John, what about this aspect of mental health? How are you addressing that, and trying to maybe assist different governments and local governments, national, regional governments in dealing with that?
Yeah, indeed, very important. And I mean, the first thing, as often, is to generate the evidence base, and that is now well established. People were really quite critical of it until quite recently, but now it is well established. And then working in partnership. So in the UK, we have partnerships with our national parks. So we had a concordat launched by one of our ministers between the national parks of England and the National Public Health Agency. The important thing, there are two aspects to it which I'd mention. One is that you have to have the assets there to generate connectedness to nature, so you need to have good quality natural landscapes. But then you also have to have services. So the asset itself is not enough. You have to invest in a process of generating connectedness to nature. It's not just putting children or people from a difficult background into a national park. There has to be some process which allows them to connect, and both of those things need to be in place. But there are good examples internationally.
Rita, you had something to add.
I would like to add.
Yes.
Yes, I would like to add that it's important to have partnerships. And also within this program, we are trying to integrate the enterprises to develop those services in forestry areas, lakes areas, so that people could easily get the connection to the nature. And the partnership building is really important of the Nature Step program, because we want to promote health and get people use less health and social services. So there is a win-win situation in this kind of program also.
Magali, je vois que vous êtes d'accord. Pourriez-vous
Margaret, I see that you agree. Perhaps you could tell us about what's going on in France nationally. Yes. Yes, listening to you all, I'm thinking there are initiatives that were taken on different scales here in France. And what's interesting is to see how public policy has gone further than actually what was slated in the beginning. There's a resilient program in schools, climate-based. We realize that the idea of urban agriculture, we see their connections. There's prevention, there's a protection of urban biodiversity, so getting children in schools and parents and the grandparents involved, building up education based on it, so better education, because there are educational projects that have gotten on board. And what's interesting is that when the project was designed, that wasn't its purpose, and the effects and the co-benefits over 4 to 5 years' time. In fact, these have gone beyond the organizers and their intent. And we see how this type of project is picked up in other municipalities with many other different initiatives and many other measures. So it's really interesting to see how you can get people involved and how you can discover over time when you have events, how they play out. And what's lacking maybe in lots of projects today in some areas is a scientific follow-up and observatories that help us understand what works, what doesn't work, how we can improve, how we can measure, to have some long-term tracking, as it were. And of course, if you have a difficulty there, it might be even truer in, say, more developed countries, if you will, quote unquote, because we tend to, in the rich countries, they're very poor people. And there's public policy today in certain neighborhoods that are certain underprivileged neighborhoods, the poor neighborhoods. Well, you can either through biodiversity or climate issues, you can create connections with people and reduce the inequality there and put focus on health, care, food, nutrition, diet. But we forget a lot that many populations are directly excluded from that access because of transportation, or they don't go out. They don't want to go out. There's just this whole host of barriers. I think they've been well studied from the public health institutes. So if we could leverage all of the feedback on healthcare, biodiversity, and climate to pool our experiences to not make the same mistakes, in fact. Hold on a second. Geneviève, could you talk more about that nationally? You're saying reducing or addressing the inequality that you said there by using climate change and health. Well, in a way of an answer there, I could say that all examples are really important. It shows that things can work, and it involves people on examples that do work. So it gives them hope, right? Absolutely. It gives them hope, and you have to have hope, and you have to keep in mind that we're not all negative, right? We're positive as well. And public health institutes, it's really about promoting environments that are favorable, positive for health. And I also wanted to stress there is a framework area to be thinking about this in the cities, for instance. We have these actions. We have public health schools. We have other agencies. And there's the quantitative evaluation of the impact on the health. You have to have measurements. This was done well in air pollution, for instance, for a really long time, but you can also add a whole host of measures on the territory level. I totally agree that point C is a level, the relevant level where you need to act. So the framework is really about measuring in a certain number of areas, and you can also add temperature, of course, and also add all of the measures, including quality measures based on the vulnerability and precarious individuals, underprivileged. And this needs to be shared with the local stakeholders, decision makers, and citizens. So we can have a very concrete idea, say, of the number of deaths or hospitalizations that could be avoided due to leveraging using the scientific data. So you can have sort of thresholds or cap levels, measurements that are standards, as it were, and you can build up scenarios based on that or options based on that we could concretely carry out to succeed. Okay, so you're saying if we don't act, it's a loss of opportunity for generations. Absolutely, and that can be measured. You can work with the local stakeholders and the existing framework. And what we do in the agency, we do that in 3 cities in France, but it could be rolled out to many others. And it just shows that there's a mechanism that's repeatable, and we could follow what happens over the long term, because you have preventive actions, public health actions require continuity and stability in action and in the institutions.
Point to make.
Another point,
Okay,
but I think
Yeah.
that equity and equality is super important in the climate change and in responding to the needs of the population. I think it's a crucial thing, and we can actually attract some vulnerable groups like young people without education or employment and training.
Yeah.
They might be very interested about this topic, and they can be interested to be employed or trained on that area. Another issue that I would like to mention is that there is the partnership between the research, communication, and also with education. So those are very important areas for partnership in health, because education provides the trained employees, but also the training for the population. And then the research brings the results which we can implement in health and social services. And the research can also produce the results of our interventions or experiments or pilots. And then the communication is important for the politicians, for the decision making, the funding, but also for the population, so that they can take their actions.
Yeah, absolutely. We got 10 minutes left before lunch. I'd like to get to a couple of questions, but John, I mean, kind of what Rita was talking about, and this idea about inequality. I mean, we're facing a lot of challenges now, because there's already been a wider inequality thanks to COVID, and also with this Ukraine crisis, energy prices, food prices going up, and then people are being told, okay, now you got to act more now to save the environment. That's a tough bill to fill, and very tough, but it's the communications that are very important, right?
Yeah, I completely agree with this discussion that we have to be very aware of the difficulties of inequalities in relation to climate. But in fact, of course, going back to my earlier point, promoting sustainable development and approaches which maintain climate and which are nature-based are a solution to inequality. So there are actually very good solutions. So
it's how you spin it.
Well, it's not. Well, it's not.
Well, I'm not saying in a negative way. I'm saying
but exactly. So it's exactly right. So it's getting that argument across, and of course, the very best way to get that message across is to do it and to show people the results. So we need to be doing projects. Ambitious projects with local council
that show results.
And we have 1 or 2 examples in Exeter where we've been working with the council in Cornwall, putting sophisticated electronic measurement tools into people's houses, measuring air pollution, temperature, energy use in a project, and reflecting that information back.
Cute little Cornwall, fisherman's town, and then you're doing that high tech.
There's a lot. There's more going on in Cornwall than you might think. But those sorts of projects can be quite powerful. We need to move fast, though. We cannot wait for years for the research funding to come, for the results to be published in literature. We've got to do this work now in an adventurous way and learn quickly by doing it.
You mentioned time. We also have just a few minutes left, and I have a couple of questions here. D'abord, la question de l'impact des...
I've got a question on the impact of energy lack of energy supply interruption and raw materials. Does that come into play? Okay, what's going on right now in Lebanese and hospitals in Venezuela? Could that happen in France?
Quelqu'un veut commenter là-dessus?
Does anybody want to take that question, those questions? Geneviève?
On a plusieurs questions, donc assez.
So I've got several questions. They're relatively, let's be brief if we could. Well, I don't think I have the skills necessarily to answer that question about predicting what could happen in terms of energy supply interruption. That's speculation.
Et c'est du soin.
It's purely speculation. And then the healthcare one, it's I think really it's all about preventing. And of course, that was mentioned. That's part of the roadmap of IMF, how public services and all public structures, public healthcare structures can mobilize to be able to have functioning that is the most favorable as regards the environment. So energy spend that needs to be, energy usage has to be limited increasingly. So it's a huge undertaking, but we have to do this. Okay, we hear about air quality, but are there any measures or indicators slated to measure pesticides and endocrinian disruptors? Yes, we have indicators. We have a host of indicators, and it's interesting because increasingly the IPCC helps us a lot because we join air issues with global warming. So it's interesting to show through these indicators and the various stakeholders how we can converge policies to save in investment and drive towards better, produce better health. Okay, next question. So
this is to you, Rita. Perfect illustration of what One Health is in practice. Of note, they mentioned health of Lahti Lake. Beyond, is there any data regarding the impact of this great action on people's health locally?
Sure. Of course, the fish quality has improved. People use a lot of lake fish for eating.
Biodiversity. Yeah.
Biodiversity. And of course, that's a pleasant recreation area at the moment, the lakeside. It used to be very, very polluted and also smelling, so it wasn't at all pleasant place. So people can sail or swim or walk around, and there is a lot of building, also construction of houses around the lake.
Okay, next question to John. Could you extend or expand on the idea that the whole world moved together for COVID? In fact, in Europe only, it was more a struggle to be the first to reach vaccine doses than a concerted approach, though that developed later, I think. It got better. Rich countries left poorer countries behind in terms of care and access to vaccines, and still do. So in which aspects do you think the whole world can move together? I guess maybe what they mean is now on the environment, right?
It's a fair challenge, and I did say that, but clearly there were many limitations in the extent of international collaboration around COVID. But nevertheless, certainly from the point of view of public health agencies, we worked together in a way that we had not, I think, previously done, and governments. And I think perhaps the thing I would stress is the fact that different sectors worked together in ways that they had never done before. So. For the health was mainstream in many areas where it hadn't been before, and perhaps that's the lesson that we need to draw out from COVID. We need to learn from the mistakes that were made in relation to COVID as well, of course.
Okay, I've got a final question here, so we can hopefully have a soft landing for lunch. And this is mentioning, it's in English, but Magali, ça va si je le dis en anglais, ça va? I'd like to share a thought after listening to Magali as a psychologist. The link between biodiversity and mental health is obviously about, quote, how I feel, connect to the living side. I'm not sure what they mean. Of the topic, recognize that being part of a whole living system made you more aware of the vulnerability of it and also your own life. To prevent depression or eco-anxiety, we need to build programs that allow people to become eco-citizens. I think that's the point at the end. And a nice way to wrap up. Ce serait une bonne façon peut-être de terminer ce panel.
So that might be a good way to wrap up on our panel. Well, yeah, if I could touch on that. Well, in a way, city citizens, it's really just about including biodiversity in the citizenship and being in cities. It's fundamental, and I think that it's almost redundant to say eco-citizen or eco-city citizen. It's just citizens.
I like the bird,
Yep.
and I like the tick, tick, tick for climate change.
So we got to hashtag that. Absolutely. Well, merci. Thank you. Merci à tout le monde.
Thank you all. And now we are coming to our lunch break until 2 p.m. Paris time. And then we'll be looking at what might be considered impossible for some people, how we can synchronize, how we can move forward. We're going to see cities who have succeeded. We're going to see some success stories, some examples, and how we all get mobilized. So enjoy your lunch, and we'll see you back here at 2 p.m. Paris time.